You guys hear me okay? I'm testing my speaker and it's really quiet.
I can hear you.
Okay, good.
Madam Chair, this is Clint. So I've got some communications here with Bob Frank. He's trying to get logged on.
Marty, can you hear us or are you froze up? You look froze up on my screen.
I have him frozen on my screen as well. Otherwise, he's very, very deep in thought.
All right, Bob is on, I think.
I think I'll give it another minute to see if Marty can get back on before starting. Do we know, has anyone heard from Dave Turk? I have not. Oh, there he is, right there. All right, I'm just going to give
now?
Oh, all right. Was that Marty?
Yeah, how about now? Can you hear me? Can you see me?
I can hear you, yep. We still can't see you,
Okay.
but we can hear you.
Well, that's good. That's what we want.
All right, I believe we have a quorum, so I'm going to go ahead and call the meeting to order. Was the properly notified and posted?
Yes, Madam Chair.
All right. And we have an 11-point agenda. I would entertain a motion to approve the agenda.
Move to approve.
Motion by Brewer,
This is Dave. I'll second.
second by Supervisor Turk. Any discussion or changes to the agenda? All those in favor signify by saying aye. Aye.
Aye.
Opposed? All right, we have an 11-point agenda. Item number 4, minutes from the February 1st, 2021 meeting. Did everyone have a chance to look those over? If there are no changes, I would entertain a motion to approve those minutes.
Make that motion, Glassfunner.
All right, do I have a second?
Bob will second.
All right, a second from Bob. Any discussion on the minutes? All those in favor signify by saying aye.
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 Opposed? All right. The minutes are approved. Item number 5, transition plan updates. Administrator Langrick?
Madam Chair, just pulling up the document here, and then I will attempt to share screen. Okay, Madam Chair, today this is an informative agenda item. Background on this item is that with resolution number 2140, we had it resolved by the Richland County Board of Supervisors that a 7-page transition plan and directives, which was developed by the temporary administrator transition committee. A copy that was attached to the resolution was approved. On that plan, the oversight and communication, the plan will be overseen by the Finance and Personnel Committee with authority to administer this plan established through our structure documents. So this will be brought forward to the Finance and Personnel Committee meeting this coming week, March 2nd. Again, it's to review the transition items and such that we had in the plan so that this committee understands and is kind of staying abreast on those moving pieces. We're currently continuing to work on the AS400 project. We do have a cache battery that is supposed to arrive to us on Friday afternoon to kind of get that system kind of patched up and working yet as we explore investigations and options for kind of replacing the system, most likely moving forward with a new box, but also exploring what a cloud option looks like, and continuing then to move that, if we go with a box, to have it over into a server room, freeing up that office then for the administrator to move into that office. So we still have pieces that are moving it in place. In regards to recruitment, I do have an applicant that has accepted. We're anticipating that a Mr. Joshua Bell will be getting with us on Thursday as the accounting supervisor. So we're going to rally the troops and provide support for Joshua as he arrives, and trying to get him acclimated and then get him going on keying and into the AS400 system. So our other directives and such are mostly underway. Thank you to Victor, who's been covering down on AS400 keying for the continued extended period here. Again, looking to have Josh in on Thursday to help kind of pick up on all those functions and aspects that Victor's been covering down on. So again, this is kind of a report. It'll be passed along to Finance and Personnel. Madam Chair, I would take any questions that you had.
Madam Chair,
Supervisor Brewer, go ahead.
you said Joshua, you cut out there for a time on my connection. Did you hire someone then as?
We have an offer that's been verbally accepted by Joshua Bell of Hillsborough. We're anticipated on having Joshua start with us on Thursday morning, this coming Thursday.
Wonderful. Congratulations.
And Joshua, assuming that he is here on Thursday working for us, comes from background mostly in private sector. He does come with a bachelor's in accounting, as well as some extensive experiences in heavily in budgeting and such, as kind of his flavor of accounting. So we're excited to have him come along and to get him acclimated and on board.
Wonderful.
All right, any other questions about this report? All right, then I would like to move on to item number 6, County Clerk Deputy position. Administrator Langrick.
Madam Chair, looking for a motion today, pending discussion, motion to add 1 full-time county clerk deputy position assigned to the county clerk. This comes from, again, resolution language. The committee shall identify staffing needs of the county administrator, evaluate staffing levels across all departments and in the county to identify what staff, if any, can be moved from the departments to the county administrator office, and identifying what office space, etc. So looking at our resolution language and the task on this committee, kind of the inferred and the extended kind of tasks that came along with that then was evaluating a deputy position for the county clerk. There is in your packet or in the folder on the web then a proposed drafted deputy clerk position description. And again, looking for discussion on that topic as it was requested to bring forth a position description.
Madam,
Yes?
I'll make the motion.
All right, I have a motion to, what is your motion exactly? To create,
To add-
to accept this job
to
description and
create,
add a
add.
full-time position?
Yes.
Do I have a second? I will second it for the purpose of discussion.
Thank you, ma'am.
I think that we will want to talk about the percentage of this probably is the hesitation on seconding this motion. So I will second it for the purposes of discussion. So I have a couple thoughts that I'll start with, and then I will ask that each of you, or anyone who wants to add to this or express their opinion to please do so. But so, I mean, I still, given the descriptions and the percentages of times that we've heard from people currently in that office that were doing those duties, and I'm still not sure if this is a full-time position or a position that should be full-time. One consideration that has not been discussed before that I spoke with Tammy and Amy yesterday is that our current clerk, which if Mr. Vlasic is on here and would like to chime in at any time, I would love to hear his thoughts on this. But one thing that they mentioned is that our current clerk works a lot of hours, and so the way that he works, you know, potentially that this position may or may not be a full-time position. However, if there was ever a different clerk, that person may not put in as many hours as Mr. Vlasic does, and then therefore this position would have a lot more duties that they could potentially be doing. So that was just an additional bit of information. So Mr. Vlasic, if you're on the call, would you like to talk about what you see as the needs for this deputy position?
This is Tammy and Amy listening in on Vic. So it's not
Okay,
Victor.
so he's not. Okay. All right. So that I guess I'm just sharing with the group that is another you know, piece of information that I learned yesterday in speaking with the people working in that office that I had not considered before. So you know, that does speak to the potential that there could at some point be a need for a full-time position if we don't have a clerk who's working 50 plus hours a week. So with that, I will turn it over to, would any of the other supervisors like to comment on where they're at as far as the percentage appointment? I think we're all in agreement that we need a deputy position, no question. The question I think we're stuck on is what percent of that position should be. Supervisor Turk,
Yeah,
Right.
Madam Chair.
yes,
Okay.
go ahead.
I guess the way this motion is presented, we're creating a new position. My understanding of the current situation is we moved 2 positions over under the administrator, and there is still 1 left in the clerk's office, correct? So,
That's correct.
okay. So I'm thinking creating another position at this time is premature. I think we're getting a step ahead of ourselves. I know there is a huge question as to what should the appropriate staffing level be, but I'm of the mind that we need to square away the people we currently have on board, and yes, you know, determining who is designated as deputy clerk is important because the clerk needs to have a deputy. But before we go about creating a new position for that, I think we need to resolve the disposition of the current position that's under the clerk.
That's a very good point. So one of the, I mean, I think we've talked about this on numerous occasions, but in yesterday, so Supervisor Glassbrenner and myself went and visited Tammy and Amy. We took them up on their offer to show us what they do and how it works and how it operates in that office. And it is abundantly clear that Amy's position is largely financial. And that there's plenty of, there's plenty of work for a full-time another, full-time financial position. So, but you're correct in that we have not dealt with that position. So, I agree that we have kind of gotten ahead of ourselves here. So, do we want to have a discussion about that position? I think it's appropriate to continue to talk about that position on our current agenda. In that we're talking about financial and administrative support and staffing, but do we want to continue that discussion of that position that's currently still in the clerk's office?
Supervisor Frank, are we currently just talking about this this motion that's on the floor, though? Is that really a separate topic? Or
Yeah, we are. So it may be appropriate to dispense with this motion.
Can I ask a question, Madam Chair, before we do that? Pertaining to what Mr. Turk said, I'm wondering if, because the actual position description, I believe it's taking those different parts from the other positions. Am I correct? And kind of putting them together along with all the statutory duties, the things that we had decided were deputy clerk or needed to remain in the clerk's office. So correct me if I'm wrong, but I'm thinking if we approve the position description and that would be kind of the beginning part of fixing the issue with what Amy is doing right now, and maybe not actually, I don't know if we're at the point of being able to set the amount, the percentage of this position, but I mean, is that part of what I guess Mr. Turk is asking? Because I feel like that position description is kind of trying to shore up the differences there.
Well, the motion as presented is to add a full-time county clerk deputy position. It's not to it's not to approve a description, it's to create the position.
Right. So I guess that's what I'm saying. Should we, instead of that, should we be presenting it that way? That we're creating a position description?
Personally, I would have no problem with creating the description.
This is Supervisor Frank. I have no trouble creating the description. I guess my question with this currently is it's set at 40 hours already, and we're not even sure what the hours are going to be. And so I'm concerned about creating a position that we are committing to 40 hours in a description when we haven't even discussed the budget part of it.
Right. I think that what I would like to do at this point is so let's go ahead and dispense with this motion as presented, and we should, at our next meeting, we can focus on these two items. I really today wanted to talk about the other financial positions we have in the county as well, to try to get a big picture idea of how we may be shoring up our financial department per se. So I guess unless anyone objects, I'd like to just go ahead and vote on this, and then
Well, Madam Chair, could I make a motion to postpone consideration of this particular item until our next meeting?
Is that, now that it's on the table and it belongs to the body, is that how you would?
I'd make a motion to postpone consideration, and then we vote on postponing it.
Okay. Yeah, that, if that's I wasn't sure we could do that, but if that's the allowed way, then I would be more than happy to do it.
Yes.
All right.
So I'd make that motion.
All right.
This
Do
is
I have a
Bob.
second?
This is Bob. I'll second that. I do have some discussion I'd like to get back to with Supervisor Glassbrenner. So I'm not sure where in this whole process we're going to do that.
Motion in a second, so now we can discuss.
All right, thank you. Let's remember the order that the stack we're in here.
I know, right?
Yeah, that's fine. We'll get through it. Supervisor Glassbrenner, you said you met with them also. Just what were your outtake on the meeting with the staff at the clerk's office?
I'm sorry, that wasn't super clear. What are you asking me?
I'm sorry, yeah, Melissa said that you and her met with the staff in the clerk's office. What was your overview of that, or what was your, she gave me her input. I'm looking for how it went for you and what you thought.
I would agree with Melissa's assessment of it. I agree that the information of the amount of hours that Clerk Vlasek is currently working really adds another piece to how are we going to decide the amount of time that a deputy clerk would be in there, because as she mentioned, not every clerk that we may have will be willing to work the amount of overtime or weekend hours that Clerk Vlasek has been currently working. So that would add in a piece to it. In addition, with Amy and Tammy, which I think we're going to be getting into this as we talk about the agenda item 8, but they currently both have very full workloads. Now, some of those things, there's future discussions, I think, to be had on, how can we modernize certain ways of doing things. But as of right now, in the current way that things are working, they have a tremendous amount of work and currently no one to back them up. So that is a big problem.
Thank you.
All right, any further discussion? All right, so now we are voting on postponing this agenda item to a future meeting. All those in favor signify by saying aye.
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 Opposed? All right, motion carries. We will put that top of the list priority for the next meeting. All right, item number 7, administrative support position. Administrator Langrick?
Madam Chair, I don't have any other materials prepared that we haven't discussed previous. This was just agended to allow for any type of discussion or action that would kind of come along from either the previous item or any types of discussion following item number 8 with department heads.
Right. So, I mean, it's still unclear to me what, if any, capacity there might be for, let's say we have the three financial, we have the accounting supervisor, the payroll and benefits specialist, and the accounts payable specialist positions all within the county administrator's office. It's unclear to me if there would be any capacity for those positions to assist Administrator Langrick with administrative duties, answering the phone, helping with the calendar, prepping for meetings, all of those things that he very much needs support and help with. It seems fairly clear that the 3 positions are pretty skeletal and already working at full capacity and then some. So we do need to keep that component in mind as we move forward, in that we still need to provide our administrator with some kind of administrative help. So unless anyone has anything to add to that, I would move on to item number 8. All right, so discussion with departments on financial and administrative support and staffing. So what happened was, as I went through that Excel spreadsheet that was created by Administrator Langrick that looked at all the different positions within the county. And when I was going through, what I noticed is that there are 7 other positions within the county, within other departments, that have financial descriptions to them. So Highway has 1 position called a bookkeeper, sorry, that's 40 hours. Pine Valley has 2 fiscal clerks. One is at 40 hours, one is at 36. And HHS has 1 business and financial service manager and 3 fiscal specialists, all at 40 hours each. That's 7 full-time positions, well, essentially full-time positions, that are scattered throughout the county, that are all doing financial work. And so my question is, 1, does it make sense that we have our financial people scattered throughout the county? And I'm not saying that it doesn't. I'm truly asking the question, does it make sense that we have 7 financial positions scattered throughout the county, and then we have our main financial positions in the county administrator's office who currently have no backup, have a hard time being able to take vacation. The payroll and benefits person, we have payrolls every week, so it's hard for her to even be gone any week of the month because there's always a payroll happening. You know, the fact that our payroll person had to work while she had COVID, all of these things are of huge concern. And so what I wondered was, do we need them all to be within these places where they are, or does it make sense to centralize them so that they could be backup for each other? So we would have backups for all the financial positions. I'm guessing that there's a reason why, you know, there's probably some people in HHS that specialize in the complicated grants and federal funding and all of those things. And there's people at Highway that have to deal with, you know, the Highway probably has to deal with how the money comes in for the highways. So I'm assuming that there are reasons and good reasons why these positions are there. But my question really is can we centralize it in a way that they would offer backup to each other? So with that, I'd like to turn it over to Administrator Langrick, who asked all of our department heads and financial people to be here today so we could have this discussion.
Thank you, Madam Chair. Yes, and I appreciate all the departments that are on here. I guess I would like to probably go through the virtual room. If we can perhaps start with HHS, we'll transition to Pine Valley, transition to Highway. And if we can just kind of understand more the financial positions, the different functions and tasks that they are performing, the hours of allocations and broad strokes on kind of what it takes to perform those functions and tasks, and then possibly to kind of talk on the different types of fundings and allocations, if there's different revenues that are associated with those or reimbursements to those. And then after explaining that, kind of then getting to the question of, is there a way to consolidate those pros and cons? So if we can kind of tee it up from that order, and then Tracy, if I can kick it to yourself and to your staff first to try to help us understand.
Yes, thank you. Can you hear me all right? Great. So I did ask Robin Hampton, who's our Business and Financial Services Manager, and Angie Reisner, the Administration and Building Operations Manager, to join, and they will probably do better than I will at filling in the gaps. So from the financial side of things, we do have 3 fiscal specialists who work under Robin Hampton's management to do all of the billing, paying of bills, as well as billing insurance and claiming. I'll ask Robin to speak a little bit more specifically about what those duties and roles are.
Can you all hear me? Great. So we have there are 3 fiscal specialists. I'll just quick run through. I do have a bulleted point list of all their duties. One of them primarily does all of our behavioral health billing. We bill insurances, Medicare, Medicaid, for the behavioral health, AOTA program, the substance abuse and crisis, as well as does some backup with the CCS program. So that's a pretty hefty workload for her because she's primarily the only one that does that billing. When clients come in, we have a sliding fee scale for the potential based on their income to do reduced fees with them. She processes all of that. She does as well all the credentialing for every one of our providers. So if we get a new behavioral health staff, she has to basically credential them with every single insurance. So that's a pretty significant piece. Otherwise, we don't get paid from the insurances. She also pays monthly all of our adult family home invoices. So she does have some accounts payable duties. She does all of our agency deposits, gathers all the checks, cash we receive, and deposits over to the clerk's office once a week. She does monthly reporting for our ADRC program. And lastly, which all three of these jobs do, is they are on a schedule. Maybe Angie can talk a little bit more about this piece too, but they serve as backup to the front desk. Whenever our front desks need breaks or lunch, we have like a rotating schedule to where they can provide coverage so that our two front desk staff could go to lunch. So any questions on that first position?
Think you can keep going, Robin?
Okay, yeah, I thought I just heard a little somebody click in, but that's okay. Okay, so the second position, she actually, and I should mention this for this, first position I talked about, she does not sit at the front desk. She's back in a private office. Second position I'm going to mention, she does have fiscal duties, but she's also one of two staff who have primary coverage for our front desk and phone calls. So that's, you know, I would say her primary job is answering the phone and taking clients that come in. But she's also responsible for our CCS program billing. So I think that program, she bills is at least 100 or 200 claims every month to the CCS program.
I'm sorry, what's CCS?
The Tracy, explain a little more.
Sure. CCS stands for Comprehensive Community Services, and that is a Medicaid program for people with mental health and substance use issues. It's a very intensive program. It's one of the largest programs that have in human services.
All right, thank you.
Correct. So she does the billing for that. We are training her at some point. We've tried, it just hasn't worked out, but to be the backup we're equally struggling with trying to have backups, but have her be the backup for the outpatient billing. Currently, we don't have any backup. If our primary biller was to get ill, we would be in a spot too. But she's also responsible for all of our public health billing, which is all the influenza and vaccinations, TB, blood tests. She bills for all of that and puts the information to Word. Another big piece is the loan closet. That's her responsibility. People can come in and rent all different sorts of equipment like walkers and things like that, and she checks them in, bills for it and whatnot. As well as she takes care of all the public health deposits, which for the nutrition program, that's several $1,000s every month, and she has to reconcile the bank accounts, whatnot. She also processes our monthly statements to clients for the behavioral health services. Tammy, the first fiscal specialist I mentioned, I shouldn't use names, or I could, but she does all the billing to the insurance companies, and then Nikki, our other fiscal specialist, does all the billing to our clients for outstanding services. She also has to enter every mental health service into a program called PPS for state reporting. So that's a significant workload, as well as she's our backup for agency deposits. So that's primarily the second fiscal specialist. And like I mentioned, she's at the front desk. And oops, where'd my third go? And all of the fiscal specialists are 40 hours a week. I should start off with that. And then our third is responsible for all of our vouchers that have to go to HHS board every month. She gathers them, enters them in AS400, and prepares a sheet to go to board for approval every month. She books all staff and conference, hotel and conferences. She does our cuts checks every month for our rep payee program. That's part of the CCS program, right, Tracy?
It's more than CCS, but anybody who has a representative payee who receives disability, we are responsible for.
And then the bulk of her position does billing and reconciliations for 3 of our programs under behavioral health. Our Birth to 3 program, she does the case management billing for that, as well as our children's long-term support service program and our CCAP, which is another children's program. She does all the billing for those, as well as cuts checks out of WSACWIS, our the program that issues checks for like foster care payments and whatnot, and reconciles that. She also is back up to the main front desk. So those are those 3 positions. Oh, I guess I didn't have, do you want me to go over, I suppose, my position as well? I didn't have a little write-up on mine. It's handy. I can grab my position description. I would say the budgeting piece of my position is a huge part of it. I'll just give you I guess the top maybe 5 things that consume most of my time, as well as the claiming every month. And I should back up with the budgeting. Our budgeting and let's just say our revenue expense accounts is not comparable to a lot of other places. I have experience in my past 2 positions, not with the county, doing budgeting, and I would say our budgeting is extremely complex because we have, I think I counted last time, there's over 1,000 different revenue lines to track, and way more expense accounts. It's a very complicated budget. Tracy, do you want to maybe expand a little bit more on how our funding works, or talk anything about that?
Well, I guess from the perspective of Robin's role, because of all of these various funding sources, she has to track and ensure that we're staying on budget with each one of those. And because we don't have an accounting program that allows her to automate a lot of that there's a lot of taking data from the AS400 and then kind of making it more usable for how we need to track. And so she spends quite a bit of time to assure that we stay on track with the budget. And then also doing all of the claiming state, get all of the allocations that we're entitled to get to fund the program.
Yep. And then I have, I would say, WIMCA reporting. That takes a huge amount of time every spring, as well as I would say 20 maybe % of my time I spend dealing with, I would say the outpatient billing, behavioral health billing. It's just grown so much, and the person doing all that billing does need a decent amount of support. We just run into a lot of odds and ends things, compliance related things, things that need to be approved that are, I would say, above her level. So there's just a lot of work to be done with running an outpatient clinic.
Just to kind of wrap up a little bit of what Robin is saying, each of those fiscal clerks, those Robin's positions, become pretty vital in terms of being able to be co-located, not only because of the backup roles that they do with managing our front desk and our reception, also because of that need to have close collaboration with the programs that they're interacting with. To ensure accuracy, the programs really program manager needs to work very closely with the billing type to make sure that we're accurately billing and capturing all of the revenue that we're entitled to.
So as far as the reimbursement piece, our positions get, okay, let me just quick pull up my sheet. I want to make sure I don't miss anything here. With our whole admin program, it's a little, I would say, hard to say directly where everyone's funded from because we take our whole admin program and we have several funding sources that just fund our whole admin program. A chunk of it is tax levy. A chunk of it is our basic county allocation from our Department of Health Service, or DHS funding. And then we recoup AMSO, which is, what's the acronym for, Tracy? It's basically
Agency management
overhead. Basically, we can recoup some of our overhead from some of our other departments. So some of the departments in the building fund us as well. So basically, funding above and beyond tax levy to cover the whole admin unit is, I would say, over half. Does anyone have any questions? I'm not sure what else.
So, I mean, listening to you, it sounds like very specific positions related specifically to the work done in your department, not necessarily just paying the bills like your light bill and your phone bill that would go through the county, but these are getting reimbursements from the places that fund the work you do. Is that accurate?
Pretty accurate. We do have a person doing payroll as well, but that's under Angie, so I'll let her talk about that one.
I do have a question for Tracy and or Robin. So is this similar design, is similar plan structure, I should say, that other counties do? Are other counties gone to a privatization of this type of work? Can you give me some input on that, please?
Sure. I would say it's pretty similar. Just my experience with La Crosse and Jackson, Monroe counties, it's similar, even though they are financial dependent in a couple of those. The staff who do the work do tend to be embedded in the human services agency because of the need to close connection. There are some counties who have privatized their billing, but I'm not sure that they've found that to be more cost effective. It just may be that they don't have that expertise within their agencies.
All right, thank you.
Any other supervisors have questions for the staff from HHS? Thank you very much. I mean, I assumed that we were going to learn what we just learned, but it's good to hear it and to really think about how specific some of these positions are. All right, Administrator Langrick, did we want to move on to the next department?
Madam Chair, I believe I have representation on here also from Pine Valley. I think Tom is on, and I don't know if he's got supporting staff with him, but Tom, if you can hear me, if we can kind of.
Excuse me, Mr. Langrick. I think Angie was still going to speak about the payroll position under her.
Oh, thank you. Thank you. Yes, I'm sorry. We glossed over that. Angie, do you have availability to speak on that position?
So if you're talking about just financial positions under me, that would be probably one of the largest things is doing payroll. So we have one confidential administrative secretary. We actually have two, but one does the payroll and the other one functions as the backup, as well as myself. So we take care of all of HR. And then we also have the front desk coverage, which, like Robin had mentioned, is rotated also with backups from the fiscal specialists. And there's one of her three that sits up there permanently. Another piece that has been added, obviously, with COVID this last year or two now, is that all of those staff, whether they're under Robin or myself, do testing sites work as well as vaccine clinic work all day long at these COVID sites. So they're pulled from their jobs and put out on site at these different locations as well. But financial tasks are really payroll, yes. And contracts, I don't know if you want to call that contract monitoring. I do all of that, monitoring and creation. So those are some big dollars that we take care of as well in administration. Otherwise, it's a lot of HR policies, building, front desk, support staff work, releases of information, all of that runs through me as well. But financial is just that payroll and contracts. Any questions?
I just want to back up what Andrew said. The staff are pulled for a vaccine and COVID related things. They actually don't really have the time to do this. This is on top of their position. And I know staff are stretched super, super thin right now. Basically they're trying to do more with less and getting behind on their current workloads. And it's definitely a challenging time for the things that we have added to our plate.
I'm sorry to have skipped you, Angia. All right. Anything else you guys would like to add? Anyone from HHS before we move on to the Pine Valley? All right, so let's move on to Pine Valley then. Thank you.
Good afternoon, Tom Rislow here, and I got Therese Deckert with us, my business office manager, who's known on the wage scale as the administrative assistant, and Chris Glassbrenner, our HR director, and I'll let Therese kick it off with staffing in her department.
All right, so there's three of us in the business office, and myself, and then I have two fiscal clerks. And we are a skeletal crew as well. We are responsible for a $9 million budget. So the fiscal clerk that does the AR side of things, we need her here. She brings in, there's approximately $8.2 million in revenue. So if we started branching out, not being here, we would see a decline in that, because it starts with the admission process that she's checking to see what the pay source is. She's working with Medicaid, Medicare, commercial insurance, private, outpatient. And also I work closely with both of these fiscal clerks, and with her, we're working together to keep our days in AR at under 40 is our goal, which we have met. And I also get input from her before I go through with collections. And then the other fiscal clerk, and I'm just doing a brief summary here, she is actually, her title would be more appropriate to be payroll and accounts payable. We have over 160 employees, and our payroll is very complex. You know, we have to follow the Department of Labor rules, the county policies, Pine Valley's policies. So we can have, with the staffing crisis, we can have an employee work in two different departments with two different payrolls. They're working as a nurse and they're going to get overtime at one wage with shift differential, but then they're going to shift over and be a salaried worker that earns comp time at a different pay with no shift. That's just one example. And so by the time the fiscal clerk gets it ready, she has done all this, figured out the shift differential, and she uploads it. It's an interface file to Tammy. So it's not like we're just dumping a bunch of time cards. She has it ready to go for Tammy to finish. And along with that job, she keeps track of the benefit accruals. So we have 160 employees, and we keep track of their sick time, vacation, comp, all that is done internally here at Pine Valley as well. And then on top of that, she does the accounts payable. So she's, you know, everything from the new employees, getting them entered in, new vendors, it's the same thing. She's initiating the credit policy. She's getting the W-9. And there's a lot, as everyone knows, you don't just pay a bill. You'll look at it, oftentimes there's mistakes, you get it cleared, and dispute the charges that are incorrect, payments that aren't recorded. So, and that again is all set and before and approved, and then she sends it on to the clerk's office so they can run the checks. And then also the three of us with COVID, just like everyone else, our lives have changed and we fill in for testing. We were doing twice a week testing here for all the employees. And we would take our turns assisting with that and continue to do so when able. I myself, I oversee the budget and work closely with both the fiscal clerks, maintaining the chart of accounts, prepare the monthly financials, including monthly closing of the general ledgers. Aging and collection has been a priority to really try to get our revenues brought in a timely fashion, and that has been going well. Medicaid cost report, get information for that, which sets our Medicaid rates. Also, I get information to the auditors for the Medicare cost report and our audit. And it's really, we really need to be here, you know, because it's a phone call for an admission. If they weren't here, you know, we may lose out on some revenue, and just the time it takes. We really need the three of us to keep this, you know, nearly $9 million budget flowing and keeping it in a good state.
Questions for Therese before we go on to Chris? Okay, go ahead, Chris.
Okay, so I am the HR director. That is my title according to the wage scale, but some of my duties include the recruitment, hiring, orientation of all new staff for the facility. With that also includes making sure that everyone is properly licensed, has the right certifications, whether they're a nurse or a CNA or someone that works in the business office. With that also goes the background checks, the fraud checks for all new employees. I'm the corporate compliance officer, also the safety officer for the facility. With that goes OSHA reporting. I issue all the family medical leave for the facility here, and I do work closely with Therese and others in the business office when we do family medical leave, as well as OSHA things, safety things. Mo in our business office also helps with that. I handle all the unemployment claims for our facility. We do have any training for all the staff. I'm also a licensed or registered nurse. So I do all the staff training as well. So anything that we may need training on, I facilitate. Tuition reimbursements for scholarships, things like that, I issue. Any disciplinary or performance issues, I also help facilitate and help with our managers here as well. I think any medical leaves of absences, helping with writing of policies and procedures. Also, I am the backup infection control coordinator under Angie, our DON. And with COVID, we also have been very taxed with labor intensive testing of not just our staff, but our residents. And when we did twice a week testing, that was nearly 500 tests we would run in a week. So that's getting the supplies, that's doing the testing, whether it's myself doing the testing, getting the results, and making sure those were all reported timely. And then also PPE inventory. I work closely with Amber at the courthouse and others to make sure we have adequate supply PPE in our facility for all our staff. And then I know just other people are saying about how people aren't allowed to take vacation. Myself, I'm sitting on 19 days vacation and I get 20 more in 3 months. My job is one of those that require me to be here. It's not something that I can do remotely. With being a nurse, a lot of times, just like yesterday morning, I'll be asked to go out to the floor to either draw blood or pass medications. So it's something that if I'm here, they definitely do utilize me. So I think that's it for now.
We'll take questions, Melissa.
Madam Chair, if I can ask, there was a question that came out. If I can have kind of the payroll process perhaps explained from all the time card collection on Pine Valley's end, and then what type of a file that gets put in and submitted then to the county clerk's administration's office over here. And then Tammy, if you're still on, to be able to talk through when we receive the file, what happens to turn it into money that gets paid out.
Sure. Well, and Tammy could answer it on her end. I know that there's just not a way around it. There's a crimp interface file that is uploaded to the courthouse, and then she's got to do all her magic on her end to make it come out into her 400 system, which she could tell. But here what we're doing is employees, we all punch a clock, and then there's a lot of manual checking on this. Just because somebody punches a clock, we got to make sure it's in the right department, in the right position, at the right pay. There's worksheets, like I talked about. Sometimes they get shift differentials, other they don't, and there's a whole table of shift differentials. So there is, but I don't see any way around it. I think there is some work that is done twice, but I mean, we have Chronos here, and Chronos is the best time. I've worked through 3 different payroll processes, and Chronos by far is the best and is more efficient, and employees are able to look at their time card, look at all this information. But yes, so Mo gets it all ready to go, and then she sends it over to Tammy, and then Tammy, has to do her reconciling and getting everything right, which I don't even know, what's done there. It's a lot, but this is better than the system we've had in the past. Way back 20 years ago, we were sending them spreadsheets. Right now, at least it's imported. And then Mo, we all, our office makes sure that the rate of pay is correct. Probation, we get the status slip, so Tammy has the information she needs. We work closely together, the 2 offices, but it's a very different, our payroll is very, I would guess, different being a 24-hour facility than others. Just like they have their own rules, we have ours, and we've had different addendums over the years trying to, help and retain staff, that we have to manually make those changes. There's not a system out there that could accommodate all of them. And we have people jump from full-time to call into part-time. That changes constantly. And, we accept it. We got to keep our facility running. So whatever it takes to keep employees here.
On behalf of Payroll at HHS.
Tammy, are you still on, Tammy?
Yes, I'm still.
Can I kind of have you explain then, when you receive the crimp file, what kind of goes into it then to get it into the AS400 system to release for the note to the bank?
So when Mo sends me the payroll file, I have to do a couple different things. I have to save the file to the C drive, and then I have a special icon on my desktop to be able to bring the data into our 400 system so it's readable. Once I get that imported, I have to look at all the summary warning messages that are out there to see if someone is like a full-time or a part-time person that would have benefits that should be deducted. So I have to account for those employees that didn't have hours, because I also handle all the billings for all the insurances. So I have to make special notation that employee X didn't work hours, they have health insurance. So I have to account for that. If employees work in more than one department, so if they're a CNA, which is a job code 50 or job code 260, if they work as a resident assistant, that's a job code 262, or if they work as a personal care worker, that's a job code 261. I have to make sure that those hours are budgeted to the correct department. So there's 5429 is for personal care worker, that's their CVRF. CNA is a department of 5423. So I have to go through the job codes when employees work in different departments and assign their correct department. So that way, when I give them their labor and benefit report and their non-productive report, they can handle all their billings that they need to. If they have anybody that does on-call like their nurses do, they do an on-call. Because of Wisconsin retirement system, I have to take their overall earnings and figure out how many hours are associated with those earnings and enter those into payroll for Wisconsin retirement system. So there's just a lot of little things that I have to look at with, within the payroll once I get it, before I can even start processing it. So Mo and I are continuously working back and forth. When they send it to me, I will immediately bring it in through a validation process, and I'll send it back to Mo, because we're generally off anywhere between $20 to, we could be off a couple $1,000s. So we have to figure out, was something missed on her end? Did the interface not bring something in? Or is there something I need to account for and adjust on my end? Like with any payroll status change forms. Mo might have it one way and I have it the other way. So then we have to check and see which way the system brought it in and make those adjustments as necessary. So that's the easy end of it.
Tammy, this is Supervisor Frank. A question. You said between departments, is that also, do you also then validate if someone works at two different departments? Maybe they work at a highway and they work at Simons or something like that. Is that something you have to track hours for the state retirements and these other options also?
Yeah, we have several, we got a few employees that work in more than one department. Like some people work at Simons and they work at Pine Valley, Sheriff's Department and probate. We have a bunch of translators, some translators that work in different departments. So we have an interdepartmental spreadsheet. And when those employees work, the appropriate department is supposed to enter those hours in on a weekly basis. So that way, if the second department calls them into work, they can look and see, are we getting to overtime? So that way we charge the overtime to the correct department if they go over 40 hours in a work week.
Thank you.
All right, Administrator Langrick, did you need anything else, or did that answer the questions?
I think I'm satisfied with a deeper understanding on it. I don't know if there's any other questions that committee members had, Madam Chair.
Any other committee members at this time? All right, so I think the only financial position that we haven't talked about would be the highway, the bookkeeper position at the highway. I don't know if anyone from highway is here today.
I think we have Lisa, who is on from highway. Lisa, can you hear me? It says you're speaking, but I cannot hear you, Lisa. Can you hear me, Lisa?
It doesn't show that she has a microphone on her computer from my end, guys.
Okay. Lisa, are you able to call in on the WebEx number that was attached on the agenda or to the Outlook? I'll give you just a minute here. I guess while we're waiting here.
She can see.
While we're waiting for that, I guess this is a lot to take in, which is why I'm immediately formulating questions. But as I'm looking over this, I'm hearing from these departments, how that it is important that their staff be on site. But I guess my question is specifically for the positions that function more in payroll. Now, it may not be ideal, but I guess I'm wondering, would it ever be feasible for those positions to be more centralized?
Tom at Pine Valley, I think Therese has a comment to that. I believe we see so many of our staff stopping in our business office to ask questions related to payroll. Therese?
Right, and we're trying to track down a punch. I mean, if people, they punch in for the day and they don't punch out, we're not going to pay them until we can verify when they left. The supervisor signs a slip.
That's one of them.
So that would be one example. Oftentimes they're stopping in like, you're full time, but you only have part-time hours. Oh, I forgot to tell you, put in 3 vacation days. Yeah, so if we weren't on site and there's such a tight deadline for the employees. There's such a tight deadline to get payroll done. And Mo has often come in on holidays. She comes in on weekends because that payroll's got to get done every other Monday. And so, yeah, if she wasn't here, we would never be able to meet that deadline and get the information we need.
I would say
Phone calls, of course.
this is Tracy from Health and Human Services, and I think Angie will probably chime in here too. Payroll is not the only duties that the staff who manages payroll, so there are other duties that staff person has that are needed here, and then the backup also has duties. I don't know if you had more that you'd like to say about that, Angie.
That our payroll is very similar to what Pine Valley mentioned, but we use an Excel spreadsheet, and Megan populates that, a lot of on-call comp, regular comp, lots of complicated situations. So-and-so's on FMLA, someone else got something else going on. So that's why she works really closely with me with HR, because all of that funnels through me, and then her and I work very closely on keeping those issues confidential. She also audits a system called Clockify to payroll, which Clockify is how we track funding sources for all these individuals. So that's something that she does, constantly chasing down documents and corrections and things like that, just like Pine Valley had alluded to. But Tracy's right. She does a lot more than just payroll. She does. She even works the front desk.
Yeah, I would say that Pine Valley as well that staff person is not just focused on payroll all day.
I don't know. Lisa, do we have you on now?
Yep, I'm on.
Hi, good morning, Lisa, or good afternoon now.
Good afternoon.
Thank you for joining us. If I can ask you, I was going to begin kind of talking into the context of highway and my understanding of how everything kind of gets put into projects for your billing and your cost tracking, and I believe we're through new roads, if memory serves.
Correct.
Can I have you kind of talk to the extent of the financial functions that you're performing out there, the different tasks, the allocation perhaps on time? If you can expound on how your cost accounting out there with everything being in projects and how that interfaces with the county.
I'm not exactly sure what you mean, but everything that we do, vouchers, payroll, everything goes through the cost accounting system, and we have to charge everything out to certain projects. Right now, Cresta does that part of it. Right now, I'm working on year-end financial statements, so I'm trying to sort through all the projects, all the cost accounts, make sure they all balance with our trial balance. Is that any help in what you're asking me?
I think so too. Can I have you talk to the extent, so like with all the projects, like if you're doing township projects, it gets put on a township project, all the cost of materials, equipment that's used, hours on equipment, and then personnel expenses kind of all get packaged into that project so that you can charge that out to a township. If it's county, it would go to county. If it's state, it goes to state. Is that the right way to view that?
That is correct, but it's just not that simple. There's like 16 townships. Oh my gosh, there's like 13 state projects, normal projects, and there's DMAs, PBMs set up separately that gets charged out, county projects, and it's just not one lump sum of county projects. Like the snow, winter maintenance. Every time, let me back up. For instance, the guys go out and plow snow. That gets charged to an account. If they're brushing, that gets charged to an account. So we Caressa keys all that in, and then at the end of the month, we just run a trial balance out each account monthly. Our trial balance is 15 pages, and I mean, and they're all different cost accounts that we have to charge things out to.
Past the charging then, Lisa, do you have involvement then with the timekeeping and preparing the time cards for payroll?
Caressa does all the payroll.
Okay.
She keys in all the daily time.
Okay. Interface then with the county down here. Can I ask you in regards to with the trial balance and balancing with the books down here, so our general ledger kind of reflects what your cost accounting program is. That would typically be done on a monthly.
Typically, it would be done monthly.
Okay.
I have not balanced our cash account with the clerk's office since August was the last time I did it.
Okay.
When Derek left.
When Derek was there? Yep.
Mm-hmm.
Okay. Okay. Madam Chair, I think that was all the questions that I had.
All right, thank you. Thank you to everyone for coming today. I mean, I wasn't coming into this thinking that we were going to solve any great problems, but what I thought was that we could start a conversation about, is there a way that we could be more centralized that would make it more efficient so that every department would have backups? And so I guess what I would like is I would like you all, you're in the positions, you know what you're doing, and I know that everyone's overworked and busy, but I've heard several times the notion that you don't have backup and you can't take vacation time. And so I guess collectively, is there a way we could think about this in a little different way, where we could, as a group, come up with some way to have backup so people can be taking vacation, because that's employee retention, is, people being able to actually use their vacation time and not be working crazy hours. And so I guess I would really like everyone to just think about this and try to think about solutions and maybe think outside the box. And I'm not saying we're going to make any changes that we're going to make you all go to one department, because I agree, being in the location where most of your work occurs makes sense. But from the standpoint of trying to create backups for people in all of these different departments, is there anything we can be doing or should be doing that might facilitate that? So that was really my main purpose in having you all come together today, was to have this conversation about, look, I'm like the former vice president, I have a fly on my head. A really big fly too. So anyway, if you guys could really think about that as a group, we might have further discussions about this, just because, and I think that this is something that really we may pass off to the administrator as really being under his purview. But I wanted the board members to be able to hear what your workload is, what your jobs are, where you're spending your time, as a starting point, but then let's start thinking outside the box to try to solve some of these problems so that people can actually take vacation that they have, and are not working crazy hours without any time off. So, all right, does any other supervisors have questions for the members, the employer today?
This is Supervisor Frank. Question for Tammy. Tammy, are you getting all these different departments' information in different formats, and then it's going into the AS400? That question makes sense.
Okay, so there's 9 payrolls that I process. The 1 week I do the highway and the Pine Valley payroll, and those are interfaced to me. Highway has a different system within the 400 system that is, I just bring it in, I import it, and I just have to compare GL numbers, make sure that they transferred right. For the most part, the highway is probably the easiest payroll for me to process. Pine Valley, as I already discussed, theirs is a totally different system, which I have to import. And then once those payrolls are done, then Thursday, Friday, I begin work on the courthouse and Health and Human Services payrolls. The courthouse payroll, pretty much everybody is set up for either their 35 or 40 hours, and I just put through any benefit time that they've used. Health and Human Services, they get me an Excel spreadsheet. I have to cross-check all their absence sheets to what's in the Excel sheet. Then I have to enter that data into my vacation sick time sheet to make sure that we balance. And then I enter all that data into the 400 and process payroll. And then the next week, then I finish up with Simons and Sheriff. They both get me a spreadsheet. And again, it's, making sure all the data is correct and accurate, import it into the system, and then process the payroll. So it's Highway and Pine Valley the one week, and then the next week I have to have Courthouse, Health and Human Services, Sheriff, and Simon done. And they have to be to the bank by 11 a.m. on Wednesday morning because the bank requires a 2-day processing time for direct deposit. So that's why payrolls have to be to the bank by 11 a.m. And many times I am pushed to that limit because some people are not very good at getting their hours turned in on time. So we're trying to scramble getting everything in and entered. And then once a month, I have to process a county board payroll, a fair payroll, and a monthly payroll. The county clerk will enter the data for the per diems for the county board. The fair, I get a timesheet for those people and enter that data in. And then the monthly payroll, the coroner and the emergency management director get me the payrolls or the hours, and then I enter those into payroll and process.
But you're getting them in multiple formats and in some cases needing to, as you say, import and check data as you go through. So thank you.
Tammy, I'm assuming that that it's cost prohibitive to try to find some kind of system where you wouldn't have to be getting Excel spreadsheets where data could be entered into a payroll system that you'd have to check but wouldn't have to manually enter. I'm assuming that that's just something that's really cost prohibitive or just not something that we want, or can you talk on that a little bit?
For the most part, I get Excel spreadsheets from everybody, and then I just enter it into a time form system because all the different codes, there's 01 is a full-time employee, 02 is a part-time employee, 03 is a temp casual employee or a call-in. Then there's your associated vacation, sick. A lot of people don't know those codes. They just say, I use sick time, I use vacation time, I use comp time. So that's where because I have the brains behind the payroll with all the codes, all the GL numbers, all the departments. The other people that give me the payroll, they don't know that stuff.
So, I'm familiar with the Chrono system where the employee just enters their hours and all of the information is handled by the payroll people processing it. So you don't think it would make sense for us to go to a system that would be countywide, like a Chronos type system? Is it not AS400? Is that the problem?
I have nothing to compare to, so I can't say yay or nay.
Okay.
I'm just looking at if we do go to a different system, I have a very limited window with which I can be down because I'm continuously doing payrolls.
Right.
So if we went to another system,
Right. Obviously it's complicated, but okay. I just didn't know if it's something we talked about in the past and just decided it wasn't financially feasible, or if we've not had those discussions on how we could have one system for the whole county and not be quite so work intensive. Because you're literally taking the numbers from the spreadsheet and typing them into the payroll system. Is that correct?
Yes.
Okay. All right. Well, that's, things to put on our to-do list for the future is to just talk about how we can work to improve these things. In the meantime, it is what it is, and it takes as much time as it takes, and we have to figure out how we can make it better for those of you that are doing it. So, all right. Is there any other questions from supervisors? All right. Well, thank you all very much for your time. I really appreciate it. I think it's really important for us as supervisors to be able to get a better understanding of how much work it actually takes. My takeaway from this is that, you are doing some very specific work that's, very specific to the work that you're doing in your department. I haven't given up hope that there's some way that we could try to centralize at least somewhat, in, if not, maybe not in location, but maybe in some training so that there would be better backup, you know, around the county. And I would look forward to hearing any ideas people have on that topic. And certainly Administrator Langrick it would probably be appropriate for him to follow any further discussion on this. This is not necessarily something we were tasked with in this committee, other than we are supposed to try to determine what staff he needs to do the financial responsibilities that we have tasked his office with. So,
Melissa, Tom at Pine Valley, Clint has asked us to be thinking about this, and we have put our heads together out here and came up with a few ideas for possibly being of assistance to the county, and we'll shoot those ideas to Clint.
fabulous. Yeah, I think you guys are the ones that are in a position to know like what's possible and not possible. So I would really appreciate, and certainly if you are comfortable talking with this committee at a future date, depending on what you and Administrator Langrick come up with, that would be fantastic.
Thank you.
All right. Anything else that the financial people present would like to talk about at this time? Anything else you think we need to know? You're obviously always welcome to contact any of us individually, or if you feel there's something we could be talking about in this meeting that would be helpful, shoot it to myself or Administrator Langrick, and we'll make sure we can get it on the agenda so we can have these discussions. All right. So if there's nothing further on that agenda item number 8, I would like to move on to agenda item number 9, which is just to review that report that I wrote that was presented to the board on January 19th. So I guess what I would like to know is if there's any changes you'd like me to make before we finalize this document and put it on the county website for public consumption. I read it over again today. I mean, other than deleting that first paragraph where I said that I wrote it, you know, is there anything else that I suppose I'm specifically speaking to Supervisors Turk and Glassbrenner because they were on the committee when we, during these meetings, we hadn't expanded the size of the committee yet, but if any committee member has input on this, but if not, you know, if there's anything you'd like me to change, let me know. Otherwise, I would entertain a motion to accept the report as written, however you want to do it.
Yeah, this is Dave. I'd make the motion to accept the report as written and get it published out there.
All right. Do I have a second?
I can second that.
Okay. I have a first by Supervisor Turk, by Supervisor Glassbrenner. Any further discussion on the report? All right. All those in favor signify by saying aye.
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 Opposed? All right. I will go ahead and make those changes and then I will submit them so that we can get it published on the website. Item number 10, proposed future agenda items. So I think one would be the next meeting we need to further discuss the accounts payable specialist position that is still within the county clerk's office, as well as the deputy position would be, I think, our next big priority. Anyone else? All right. And with that, I would like to set our next meeting date if possible. I was thinking that we should try to meet probably in a couple weeks, just so that we can keep that, until we get that third position sort of figured out. I think we need to keep pushing fairly hard. Okay. So, was that Marty?
No, that was Bob. I agree. That's a great idea. Let's keep pushing forward.
Okay. Yeah. All right. So 2 weeks would be, gosh, is that March already? Wow.
Halfway through March.
Right? Wow. So the week of March 8th, is there any days that, I mean, I'm open Tuesday and Thursday and Friday afternoons. Does Tuesday the 9th work? Does it not work for anybody?
That wouldn't work for me.
No? How about Thursday?
Thursday is wide open for me in the afternoon.
Thursday's not great for me, but I could make it work if I have to.
Well, Wednesday we have our strategic planning thing, I think, is what's on my.
Yeah.
Yeah. So we could meet before that if Wednesday is better. Or Friday.
What Friday? I like Thursday earlier, or Fridays are good for me early.
Ingrid and Dave, does Friday work?
It would have to be after 2 for me.
That would be hard for Marty.
Yeah.
So Wednesday? Did Wednesday work?
I could do Wednesday at 1.
Wednesday at 1? Does that work
2
for
would be
you,
better,
Bob?
but yeah, 2 would be better. I'm usually in an area where I don't have good signal until at least 1 o'clock on Wednesday, so 2 would be better. If that, what's Marty's schedule again? Though I forgot about that.
He has to leave for the school bus at 2:30, I believe.
Oh, sorry about that then.
Yeah.
Well,
Monday. What about Monday? I mean,
I can do Monday.
I have a 4 o'clock meeting on Monday, but I'm available before 4 on Monday.
Yeah, I'm busy Monday afternoon.
What time in the afternoon, Dave?
I have 2 and 3 o'clock meetings.
So
if we wanted to do it 12:30 like we did today, as long as I could duck out by 2 o'clock.
30 is always good for me. Or 12:30.
Ingrid, does that work for you?
Yeah, that works. I can even go a little earlier than that if we need to. So.
Oh, I'd love that. That'd be great.
I mean, we could do mornings too. I don't know why we're always picking afternoons. I think it just sort of happened that way.
Well, half of my mornings every day are full. So
Okay.
it has to be later mornings if we do it. But I could do 11:30 or 12:30.
11:30 would be great on Monday if we could.
Does that give you so how about, does 11:30, so on March 8th, Monday, March 8th at 11:30, does that work for everyone?
Works for me.
I can do that.
Mr. Langrick, does it work for you?
Wisconsin Counties Association has their weekly meeting that starts at 11, but I can see if I can find somebody else to kind of help listen in to gather any points from that. So I can make Monday the 8th at 11:30 work.
Should we do noon just to give you a little cushion?
That would be
Noon
great
works
as
for
well.
me.
Okay, let's do
Noon works.
noon.
There will be with our the office here, though, we kind of work through kind of the lunch times on staggering people out to get their lunch hour in with Tammy and Amy. So there might be some spottiness there if we want to get into questions with them. So just advised on that.
Okay.
Okay.
All right. Well, let's shoot for noon on March 8th and see if that works. All right. So I would entertain a motion to adjourn until Monday, March 8th at 12 o'clock.
This is Bob. Also move.
Have a second?
I'll second.
All right. All those in favor signify by saying aye.
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 All right. Thank
Thank
you,
you.
everyone.
Thank you.